scapular dyskinesis. So this is a very common term you hear these days. Lots of patients have this written on their OPD sheets. Is it a diagnosis? Is it a physical condition? Is it a physical impairment? What is it? Is it a disease? Why does it happen, and does it require treatment, and what is its significance? All these questions I'll try and tackle in this interaction with you. Okay, so scapular dyskinesis, it has been said that it is an important contributor to shoulder pain. And there are lots of theories and lots of literature, actually not theories, that dyskinetic scapula, what does it lead to? It leads to altered kinematics of the glenohumeral joint plus the AC joint. It leads to altered kinematics of the muscles which are inserting on the scapula, and leads to a spectrum of clinical complaints. So it doesn't cause a single complaint, can lead to a number of complaints. So that's the importance of scapular dyskinesis. But what is it? What's its definition, and how do you diagnose it? So if we go back to the historical, the history about scapular dyskinesis, if you go back to 2003, there was a paper by Steve Burkhardt, and he's a famous orthopedic surgeon, shoulder surgeon from US. And he talked about basically the overhead athlete, the disabled overhead athlete. It was a 3-series paper in JBJS, and I think it's available online. I think it was in Journal of Arthroscopy. So he talked about in 3 series of lectures, why does an overhead athlete have pain? And in one of those lectures, he gave the term called as sick scapula, S-I-C-K, sick scapula. SIC was acronym with S, I, C, and K standing for different terms, and this was the foundation on which we came up to the term as scapular dyskinesis. Later on, they started a group of meetings called the International Scapular Summits, in which they just closed door meetings, people who were just doing research on scapula, and they came up with the term in 2007 of scapular dyskinesis. So sick scapula is the older terminology which was used in the last decade, the last decade, 2010 to 2020. The scapular dyskinesis is the term. Some people use the term scapular dyskinesia. Kinesia is a term referred to a neuromuscular disorder, so not to abnormal movements. So dyskinesis is a better term, it said. So we should stick to the term scapular dyskinesis. Sick scapula is an older terminology, and scapular dyskinesia is not a proper terminology. So, but what is scapular dyskinesis? So for understanding this, we have to understand what are the scapula movements and how do we name them. I've talked about in different lectures already. Just a revision: if this is the scapula, the right scapula of the patient, my hand, so the movements occurring in this plane are known as anterior tilt and posterior tilt. This is tilting. So anterior tilt is shoulder going top of scapula tilting anteriorly, and posterior tilt is top of scapula tilting posteriorly. So then there are rotations, upward rotation and downward rotation. I'm talking about the right scapula of the patient. You are standing behind the patient, seeing is the scapula. This is the scapula. So upward rotation is when the acromion tilts upward. The lower water is going upward, and acromion is also tilting upward. This is upward rotation, and downward rotation. Acromion tilts down. There's another rotation called internal rotation, also known as protraction, and retraction, which is known as external rotation. So you have to understand these movements: anterior tilting, posterior tilting, upward rotation, downward rotation, internal rotation or protraction, external rotation or retraction. So external rotation, retraction is scapula moving posteriorly towards the vertebrae, and protraction is moving along the chest wall anteriorly. That is protraction or internal rotation. Similarly, clavicle movements, you understand there are clavicle movements occurring when during the normal overhead motion. So clavicle main movements is anterior rotation, posterior rotation. Retraction is like retraction of the your scapula, retraction, protraction, and elevation and depression. So elevation is lateral angle moving up, lateral, and depression is lateral and moving down. What happens when you take your arm normally overhead? Normally, when you take your arm overhead, the clavicle elevates a little, but the main movements occurring as retraction and posterior rotation. So main movement occurring of the clavicle with your overhead movements is posterior rotation. What happens with the scapula when you take your arm overhead? So the scapula upwardly rotates. So this scapula rotates upwards. Okay. So this is the diagram. If you see the diagram, this is your upward rotation. So upward rotation, it tilts posteriorly. So posteriorly tilting. So your upper end of scapula tilts posteriorly, and it's internally rotates in the starting part of your overhead movements. But to get full overhead movements, it has to externally rotate at the end of your terminal overhead motion. So the three important movements for you to achieve a full, painless, uninhibited overhead elevation of your arm is upward rotation of scapula, posterior tilting of scapula, and in the end, external rotation or retraction of the scapula. So these are the essential movements occurring, which are normal biomechanics. So you are just looking at this video. So look how the scapula is going: posterior tilting, upward rotation, just when your arm goes up overhead, upward rotation, and posterior tilting. Beautifully demonstrate in this video. And there's also if you notice carefully, there is some external rotation or retraction at the end. So this is normal biomechanics of the shoulder. This you need to understand.